For alternate assignment, I'll be talking about type 2 diabetes. Of type 2 diabetes. According to the CDC, from 2001 to 2020, diabetes prevalence significantly increased among U.S. adults 18 or older. 37.3 million people have diabetes. That's 11.3% of the U.S. population. 28.7 million people have been diagnosed with diabetes, and 8.5 million people who have diabetes have not been diagnosed and do not know they have it. 37.3 million Americans have diabetes, and 1 in 5 don't know it. Distribution of type 2 diabetes. I included a chart which includes the percentage of U.S. adults 18 or older with diagnosed diabetes by race and ethnicity. The percentage of American Indian will be 14.5%, Asian will be 9.5%, Black will be 12.1%, Hispanic will be 11.8%, and white will be 7.4%. I also included in the slide that certain racial and ethnic groups are at a higher risk of developing diabetes than other groups. Of type 2 diabetes. This chart is age-adjusted death rates in the US, and the number of deaths are per 100,000 total population. There are three pathophysiologic mechanisms which are central to the development of type 2 diabetes mellitus. Includes paired insulin secretion, peripheral insulin resistance, and excessive hepatic glucose production. Type 2 diabetes is primarily the result of two interrelated problems. Cells in muscles, fat, and the liver become resistant to insulin. Because these cells don't interact in a normal way with insulin, they don't take enough sugar. Pancreas is unable to produce enough insulin to manage blood sugar levels. Type 2 diabetes is usually diagnosed by using the A1C test. This blood test indicates your average blood sugar level for the past 2 to 3 months. Results are expected as follows. Below 5.7% is a normal blood sugar level. 5.7% to 6.4% diagnosed as prediabetes. 6.5% or higher on two separate tests indicates diabetes. Signs and symptoms. Signs and symptoms of type 2 diabetes often develop slowly. In fact, you can be living with type 2 diabetes for years and won't even know it sometimes. When signs and symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of dark skin, usually in the armpits and neck. Risk factors will include weight. Being overweight or obese is a main risk of type 2 diabetes. Fat distribution. Storing fat mainly in your abdomen rather than your hips and thighs indicates a greater risk as well. Your risk of type 2 diabetes if you're a man with a waist circumference above 40 inches or a woman with a measurement above 35 inches. Inactivity. The less active you are, the greater your risk. Physical activity helps control your weight and it also uses up your glucose as energy and makes your cells more sensitive to insulin. Family history. The risk of type 2 diabetes increase if your parent or sibling has type 2 diabetes. Race and ethnicity. Although it's unclear why people of certain races and ethnicity, including Black, Hispanic, Native American, and Asian people, are more likely to develop type 2 diabetes than white people are. Blood lipid levels. An increased risk is associated with low levels of high density lipoprotein, cholesterol. Age. Risk of type 2 diabetes increase as you get older, especially after the age of 45. Prediabetes. Prediabetes is a condition in which your blood sugar level is higher than normal but not high enough to be classified as diabetes. If left untreated, prediabetes often progresses to type 2 diabetes. Pregnancy-related risk. Your risk of developing type 2 diabetes increase if you develop gestational diabetes while you're pregnant or if you gave birth to a baby weighing more than 9 pounds. Polycystic ovary syndrome. Having polycystic ovary syndrome, a common condition characterized by irregular menstrual periods, excessive hair growth, and obesity, increases your risk of diabetes. Lastly, areas of darkened skin, usually in the armpits and neck. This condition often indicates insulin resistance. Complications. Type 2 diabetes affect many organs, including your heart, blood vessel, nerves, eyes, and kidneys. Potential complications of diabetes include heart and blood vessel disease. Diabetes is associated with an increased risk of heart disease, stroke, high blood pressure, and narrowing of blood vessels. Nerve damage and limbs. High blood sugar over time can damage or even destroy nerves, resulting in tingling, numbness, burning, pain, or eventual loss or feeling that usually begins at the tip of your toes or fingers and will also gradually spread upwards. Excuse me. Other nerve damage. Damage to the nerves of the heart can contribute to irregular heart rhythms. Nerve damage in the digestive system can cause problems with nausea, vomiting, diarrhea, or constipation. For men, nerve damage may cause erectile dysfunction. Kidney disease. Diabetes may lead to chronic kidney disease or irreversible end-stage kidney disease, which may require dialysis or a kidney transplant. Eye damage. Diabetes increase the risk of serious eye diseases such as cataracts and glaucoma and may damage the blood vessels of the retina, potentially leading to blindness. Skin conditions. Diabetes may leave you more susceptible to skin problems, including bacterial and fungal infections. It also can include slow healing. If left untreated, cuts and blisters can become serious infections, which may heal poorly. Several damage might require toe, foot, or even leg amputation. Complications with type 2 diabetes also include hearing impairment. Hearing problems are more common in people with diabetes. Sleep apnea. Obstructive sleep apnea is common in people living with type 2 diabetes. Obesity may be the main contributing factor to both conditions. It's not clear whether treating sleep apnea improves blood sugar control. Dementia. Type 2 diabetes seems to increase the risk of Alzheimer's disease and other disorders that causes dementia. Poor control of blood sugar levels is linked to more rapid decline in memory and other thinking skills. Healthy lifestyle choices can help prevent type 2 diabetes. And that's true, even if you have biological relatives living with diabetes. If you received a diagnosis of prediabetes, lifestyle changes may slow or even stop the progression to diabetes. According to the CDC, healthy lifestyle includes eating healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Let's get active. Aim for 150 or more minutes a week of moderate to vigorous aerobic activity such as brisk walking, bicycling, running, or even swimming. Losing weight. Losing a modest amount of weight and keeping it off can clearly delay the progression from prediabetes to type 2 diabetes. If you have prediabetes, losing 7% to 10% of your body weight can reduce the risk of diabetes. Avoiding inactivity for long periods of time, guys. Let's get up. Sitting still for long periods can increase your risk of type 2 diabetes. Try to get up every 30 minutes or more around or even move around for at least a few minutes. Prevention. Management of type 2 diabetes include healthy eating, regular exercise, weight loss, possibly diabetes medication or insulin therapy, blood sugar monitoring. Some people who have type 2 diabetes need insulin therapy. In the past, insulin therapy was used as a last result, but today it may be prescribed sooner if blood sugar targets aren't met with lifestyle changes and other medication. A few diabetes medications include Fortimet, Glumetza, Sulfo, Nilerus, DPP-4 inhibitor. I'm sorry if I pronounced any of the medications wrong. Barriers. Regular monitoring your blood sugar levels is a very important thing to do if you want to avoid severe complications. Be aware of signs and symptoms that may suggest irregular blood sugar levels and the need for immediate care. If you have signs or symptoms of low blood sugar, drink or eat something that will quickly raise your blood sugar level. Fruit juice, glucose tablets, hard candy, or another source of sugar. Retest your blood in 15 minutes. If levels are not at your target, repeat the sugar intake. Eat a meal after levels return to normal. Barriers. Careful management of type 2 diabetes can reduce your risk of serious, even life-threatening complications. Commit to managing your diabetes. Learn all you can learn about type 2 diabetes. Make healthy eating and physical activity part of your daily routine. Work with your team. Establish a relationship with a diabetes educator and ask your diabetes treatment team for help when you need it. Identify yourself. Wear a necklace or bracelet that says you are living with diabetes. Schedule a yearly physical exam and a regular eye exam. Keep your vaccinations up to date. Summary. Type 2 diabetes is a serious disease, and following your diabetes treatment plans take round the clock commitment. To meet the demands of diabetes management, you may need a good support network. Anxiety and depression are common in people living with diabetes. Talking to a counselor or even a therapist may help you cope with the lifestyle changes or stressors that come with type 2 diabetes diagnosis. You can visit the American Diabetes Association website to check out local activities and support groups for people living with type 2 diabetes. The American Diabetes Association also offers online information and online forums where you can chat with others who are living with diabetes. You can also call the organization at 800 Diabetes.